year presentation. Today, we're joined by Jonathan Berardi, a research nurse practitioner with the Weill Cornell Clinical Trials Unit at Weill Cornell Medicine. This presentation will be done in English and Spanish. If you want to ask any questions or you want to talk to the presenter, there's a chat function at the bottom of the screen. You can type in a question, and the presenter will be able to answer your question during the Q&A section of the presentation. At the end, we will have a short poll about today's presentation. Please fill it out if possible. Muy buenos días, mi nombre es Kenny Wu y yo soy el coordinador de programas en Weill Cornell CTSC. Muchas gracias a todos ustedes por atender nuestra presentación el día de hoy. El día de hoy vamos a tener una presentación sobre el COVID-19 y la comunidad. Mantenerse a salvo en el segundo año de la pandemia. Hoy nos acompaña Jonathan Berardi, enfermero practicante y investigador de la Unidad de Ensayos Clínicos de Cornell en Weill Cornell Medicine. La presentación va a ser en inglés y español. Si tienen preguntas, en la parte de abajo hay una sección donde nos pueden enviar un mensaje y le vamos a responder.
Good morning.
Good morning.
Good morning, Doris.
Okay, good morning, everyone. Thanks for joining, and thank you, Kenny, for that introduction. Again, my name is Jonathan Berardi. I'm a nurse practitioner here at Weill Cornell, and I'm involved in clinical trial research, specifically with COVID-19. So this presentation is about COVID-19 and the community and how we can stay safe in the pandemic's second year. So in this presentation, we're going to review a brief timeline of COVID-19 in the United States, understand the causative nature of COVID-19, the causative agent, identify personal and public ways to protect yourself, and discuss current and emerging prevention and treatment strategies.
Los objetivos del día de hoy: vamos a tener una breve cronología del COVID-19 en los Estados Unidos, vamos a comprender la causa del COVID-19, vamos a identificar formas públicas y personales de protegerse y vamos a discutir las estrategias de tratamiento y prevención actuales y emergentes.
So we'll start with a brief history of COVID-19.
Vamos a comenzar con una breve historia del COVID-19.
So this is a brief timeline of COVID-19 from when the first case was reported in China, originally Wuhan, China, and that was back December 8th of 2019. There was then a report of a cluster of cases that was reported to the World Health Organization, and the new virus was identified, initially named 2019 nCoV, which later became COVID-19. As you see in January, the first case came to the United States, and a public health emergency was declared later that month. We had our first case here in New York on March 1st of last year.
Vamos a hablar sobre la cronología global el de COVID-19. El primer caso fue en China. En el 31 de diciembre de 2019, China reporta un grupo de casos de neumonía a la OMS. Luego, un nuevo virus fue identificado. El nuevo virus fue denominado 2019 nCoV. Primer caso fuera de China fue en Japón. Y luego el primer caso en los Estados Unidos fue en enero 21 del 2020. En enero 31 de 2020, en los Estados Unidos declara emergencia de salud pública y el virus fue renombrado como SARS-CoV-2 o la enfermedad de COVID-19. Y en marzo 1 de 2020 fue el primer caso en Nueva York.
So after the first confirmed case was identified here in the United States, we had our first death on February 6th. This table here shows a timeline of how long it took for us to reach various case marks, specifically the number of deaths. As you can see on the right side of the screen, it took us 123 days for us to reach 100,000 deaths in the United States. By comparison, we've increased by 100,000 deaths from 300,000 to 400,000 in only 36 days. So the pandemic is compounding. It's becoming more and more contagious as time goes on because more individuals are exposed and then expose others.
Vamos a hablar sobre la cronología nacional de COVID-19. El 21 de enero de 2020 fue el primer caso confirmado de COVID-19 en los Estados Unidos. El 6 de febrero de 2020 fue la primera muerte confirmada de COVID-19 en los Estados Unidos. Aparte de eso, en la imagen podemos ver una tabla que muestra una línea de tiempo que es los números de casos. Y podemos ver que tomó 123 días para tener el número de muertes, 100.000 números de muertes en los Estados Unidos. Y luego nada más tomó 36 días para tener 400.000 números de muertes.
The next several slides show the impact that the virus has had on the New York City area, and this is broken down by borough. The number of cases are represented here, and that's the rate per 100,000 people. So we can see that the Bronx, Queens, Staten Island, they have been very significantly impacted when you look at the overall impact rate of cases in New York City.
En esta imagen podemos ver el impacto en la ciudad de Nueva York. En esta imagen vemos que es del 31 de enero de 2021. Podemos ver que en Staten Island, Queens y en el Bronx tienen la tasa más alta de casos por cada 100.000 habitantes, el número de casos de COVID-19.
This slide shows the number of hospitalizations. Again, it's a rate per 100,000 people. And we see, again, the Bronx, Queens have been very significantly impacted in terms of the individuals who are hospitalized for COVID-19.
Y en esta imagen se compara el número de hospitalizaciones por cada 100.000 habitantes. Y podemos ver que Bronx y en Queens ha sido impactado más severamente.
And this slide shows the number of deaths, again, a rate per 100,000 people. And what I want to draw a parallel to is when we talk about what we call a lagging indicator. So if you look at the overall shape of the graph, it is fairly similar to the hospitalization rate. And we talk about hospitalization rate as being a lagging indicator of potential deaths.
Y en esta imagen podemos ver se compara el número de muertes por cada 100.000 habitantes. Cuando comparamos el número de hospitalizaciones, el número de muertes, podemos ver que el gráfico es similar.
And the most important reason why I wanted to show those graphs is we've all known somebody who has been impacted by COVID-19. Whether it's a family member or a friend or a member of our community, we know someone who has contracted the virus, who's been hospitalized for the virus, or who has unfortunately passed away from the virus. And that's why it's so important for us to understand and prevent the spread of this virus.
Y la razón que mostramos estos gráficos es que nosotros conocemos a alguien que ha sido impactado por COVID-19, por un caso o hospitalización o hasta una muerte por COVID-19. Lo que queremos es entender y prevenir más casos de COVID-19.
So now we'll discuss the cause of COVID-19 in an attempt to understand a little bit more about it.
Ahora vamos a hablar sobre la causa de COVID-19.
So what is a virus? And that's the question that I want to start with. A virus is one type of an infectious agent. There are others, so bacteria, fungi, parasites, but unlike other sources of infection, viruses are unique in that we technically don't consider them to be alive. And I say that because they cannot make new copies independently. They cannot produce their own energy, and they aren't made up of cells the same way that other infectious agents are.
¿Qué es un virus? Los virus son una causa de infección. Otros incluyen bacterias, hongos y parásitos. A diferencia de otras causas de infección, los virus son únicos en el sentido de que no se consideran vivos. Esto es porque no pueden reproducirse de forma independiente, los virus no pueden producir su propia energía y un virus no está formado por células.
And it's because of these differences that identifying a treatment has been as difficult as it is.
Y por estas diferencias, identificar una forma de tratamiento es muy duro.
So if we don't consider a virus to be alive, how do they cause an infection? And the answer to that varies depending on the different types of viruses, but they all do the same thing. They enter our cells, the human cells, through different mechanisms. And once they've invaded that host cell, they use our cell to make new copies. This process of making new copies of the virus occurs very rapidly, and we call the number of copies the viral load. So a higher viral load means that the infection may be present for a longer period of time.
Los virus como causa de infección. Si los virus no se consideran vivos, ¿cómo causan una infección? Los diferentes virus pueden ingresar a las células humanas a través de diferentes mecanismos. Una vez que un virus ha invadido una célula huésped, utiliza nuestras propias células para hacer más copias del virus. Este proceso de creación de nuevas copias ocurre muy rápidamente. Llamamos el número de copias presentes carga viral.
And this image is just showing how the virus enters our cells. So to just simplify the overall graphic, the virus sticks to a piece on the outside of the cell. Once that occurs, it is able to enter the cell where it releases its genetic information, and that's what programs the cell to make new copies of the virus. As new copies are made, they're eventually released from the cell, and that is what propagates or continues the infection.
En esta imagen podemos ver el ciclo de vida de virus de COVID-19. Esto va a ser, y como pasa, el virus, cómo entra el virus en nuestras células. El virus se pega a nuestras células y una célula huésped puede ser infectada para crear 100 nuevos viriones y una infección que progresa rápidamente.
So now we'll speak more about the coronaviruses. So coronaviruses have been causing infection for a very long time, and they actually contribute to what we would consider to be the common cold. So we have some mild upper respiratory symptoms that are associated with it. And the four infectious strains for humans are listed here, this 229E, NL63, OC43, HKU1. Those are just the scientific names, but those are the strains that are capable of infecting humans. There are 3 additional strains that have been identified to cause severe disease in humans. The first was SARS, and that was renamed to SARS-CoV after the current pandemic. So SARS was identified in the early 2000s. Then there is MERS, which stands for Middle East Respiratory Syndrome. And then SARS-CoV-2, which later became called COVID-19. And you can see the is for severe acute respiratory syndrome, and then the CoV-2 is coronavirus 2.
Ahora vamos a hablar sobre coronavirus. Los coronavirus han estado causando infecciones durante mucho tiempo. Hay 4 cepas de coronavirus que contribuyen al resfriado común y producen síntomas leves. Aquí nombramos las 4 cepas, que son la 229E, NL63, OC43 y la HKU1. Hay 3 cepas que han causado enfermedades graves en los humanos, que es el síndrome respiratorio agudo severo coronavirus, que fue renombrado de SARS después de la aparición del COVID-19. También hay síndrome respiratorio de Medio Oriente MERS y el síndrome respiratorio agudo severo coronavirus 2, más comúnmente llamado como el COVID-19.
So when we speak of the novel coronavirus or any of the coronaviruses, they come from a family of viruses called Coronaviridae. And the reason why they have that name is because of the spike proteins that are present on the outside of the cell. Those spike proteins resemble the points of a crown, hence corona. And we use the abbreviation COVID-19 because it was a coronavirus disease identified in 2019. And that was the first occurrence. So that's where the abbreviated or shorthand name came from.
Vamos a hablar sobre el nuevo coronavirus. El virus que causa COVID-19 pertenece a una familia de virus llamados Coronaviridae. Su nombre proviene de las proteínas de las espigas que se asemejan a las puntas de una corona. Estas proteínas de pico son las que permiten que el virus invada nuestras células. COVID-19 es la abreviatura de la enfermedad por coronavirus 2019, por ser su primera aparición en el 2019.
Since COVID-19 has emerged, we have identified several variants, and you may have heard that term in the media. Because the virus makes those copies so quickly, mistakes are inevitable. They are bound to happen, and some of those mistakes cause the virus to become non-functional. They disappear. Some of those mistakes actually lead to the virus being better at invading our cells or evading our immune system. And when that happens, we say that a variant has emerged. Some variants emerge and disappear quickly, and others that are more beneficial for the virus persist in the population for a longer period of time.
Variantes de COVID-19. El virus hace nuevas copias con tanta rapidez que los errores son inevitables. Cuando un nuevo error hace que el virus sea mejor para invadir nuestras células, ha surgido una variante. Algunas variantes surgen y desaparecen rápidamente, pero otras son más beneficiosas para el virus, por lo que persisten en la población.
So since this slide was created, there are actually 4 major variants that have been identified, which make the virus more contagious or more severe. And I have them listed here, and I'm listing them by their scientific names. So we have B117, B1351, P1, and there's also B1426. The reason why I'm using their scientific name rather than saying the UK variant or the South Africa variant or the Brazil variant and the most recent, the California variant, is because that describes where they were first identified. That can contribute to stigma and bias. Just because the virus was discovered there or identified there doesn't necessarily mean that it came from there. And several different variants can emerge at different places at around the same time. We are currently conducting investigations to understand how these variants might impact current vaccine and treatment options. But one thing that we do know is that the current vaccines are still safe and effective against COVID-19.
Vamos a hablar sobre las variantes de COVID-19. Desde que se ha creado esta presentación, se han identificado 4 variantes, no 3, 4 variantes principales que hacen que el virus sea más contagioso o más grave. Ahí están los nombres de las variantes. Los medios describen estas variantes según el lugar donde se ha identificado por primera vez. Por eso puede contribuir al estigma y el sesgo. Se están realizando investigaciones para comprender cómo estas variantes podrían afectar las opciones actuales de vacuna y tratamiento. Las vacunas actuales todavía son seguras y efectivas contra el COVID-19.
Are there any questions about the coronavirus or viruses in general before we move on?
¿Tienen preguntas? Si tienen preguntas, usen la función de chat en la parte de abajo. I think no questions for now.
Okay. So now we'll talk about personal and public protection.
Ahora vamos a hablar sobre la protección personal y la protección pública.
So first, we want to understand the spread of the virus. And we've heard about the transmission, which occurs from person to person through the air in the form of droplets. And there's an image here on the right that shows what those droplets look like. So with droplet transmission, those droplets of saliva or mucus can linger in the air for up to 6 feet away from wherever we're standing. So when we cough or sneeze, those particles, those droplets, can stay suspended in the air, but eventually they get pulled down to the ground because they're too heavy. Smaller particles are able to stay in the air longer, but we have the droplet transmission with COVID-19. When another person breathes that same air within that 6 feet, the 6 foot social distancing recommendation, then they can breathe in the virus, and that can lead to infection in that individual as well.
La propagación de virus, la transmisión se produce de persona a persona a través de gotitas esparcidas por el aire. Estas gotas pueden permanecer en el aire a nuestro alrededor hasta a 6 pies de distancia. Finalmente, la gravedad los tira al suelo. Cuando otras personas respiran ese mismo aire, el virus puede ingresar a sus pulmones y causar una infección. En la foto describe la diferencia entre la transmisión por gotitas y por el aire. La transmisión por gotas, la tos y los estornudos pueden esparcir las gotas de saliva y moco. En la transmisión aérea, partículas diminutas, posiblemente producidas al hablar, se suspenden en el aire durante más tiempo y viajan más lejos. La diferencia en tamaño de estas gotas son menos de 5 micrones en comparación al pelo humano, que varían de 60 a 120 micrones. Before we go ahead, we do have a question. The question says, why has the bronze been impacted so much?
So that's a great question. And there are a lot of factors that go into that. The first is social distancing and mitigation strategies. The other relates to more community-based transmission and spread and prevention. So that's why we're hoping to mitigate that through these measures. And there are additional reasons that I don't have readily available at this time, but I'm happy to gather that information and bring it back to you.
Y la pregunta fue, ¿por qué se ha infectado tanto el Bronx? Hay dos cosas importantes que tenemos que tener en cuenta. Número uno, distanciamiento social. Y la segunda es cómo detener la propagación. Pero si quieren más información sobre esto, me pueden enviar un email y nosotros le vamos a responder.
So with this slide as well, I just want to reiterate and reinforce that those droplets, remember, they can stay suspended in the air for up to 6 feet. And we'll talk about why that's important a little bit later on.
Queremos asegurarnos que en parte de lo que las gotitas, la tos y los estornudos pueden esparcir las gotas de saliva y moco. Y por eso que estas gotas pueden permanecer en el aire a nuestro alrededor hasta 6 pies de distancia.
So some examples of activities that may lead to those droplets being generated and spread could be when we talk, sneeze, cough, when we're singing, or when we simply exhale. One person can infect many people, and all of those infected individuals may go on to infect even more people. So we call this capacity for being able to infect others the transmission rate. This type of spread may account for up to 40 to 50% of the cases, and many people are asymptomatic or pre-symptomatic, which means that they either have the infection and don't have symptoms yet, or they haven't developed symptoms yet.
Ejemplo de actividades en la propagación del virus. El virus se puede aerosolizar o transmitir durante ciertas actividades o procedimientos. Cuando generamos gotitas cuando hablamos, estornudamos, tosemos, cantamos o simplemente exhalamos. Una persona puede infectar a muchas personas, que pueden llegar a infectar incluso a más personas. Esta capacidad de infectar a otros llamamos la velocidad de transmisión. Este tipo de propagación puede representar el 40 a 50% de los casos. Muchas personas son asintomáticas o presintomáticas, lo que significa que tienen la infección, pero no presentan síntomas.
Once somebody has been exposed to or come into contact with an individual who has COVID-19, the incubation period would start. So the incubation period is the amount of time that it takes for someone to become ill after being exposed. In the case of COVID-19, this can range from anywhere as short as 2 days up to 14 days after exposure. And it's for that reason that we recommend anybody who's exposed to COVID-19 should quarantine for the full 14 days to reduce the risk of spreading the virus to others. And what's even more important is that 97.5% of individuals, so almost 98% of individuals who develop symptoms after exposure do so within the first 11 and a half days, which is why that quarantine of 14 days ensures that we wait the full amount of time when most people will develop those symptoms. If you do develop symptoms, that's when we would transition from quarantining to isolating. So when you're quarantining, you're trying to prevent others from becoming exposed. And when you're isolating, you are trying to stay away from everybody altogether because you are at a higher risk of spreading the disease. The only time that you should accept yourself from isolating would be if you're seeking medical care.
La propagación del virus. El periodo de incubación o la cantidad de tiempo que tarda una persona en enfermarse después de estar expuesta a la enfermedad puede oscilar o cambiar entre 2 a 14 días. Si está expuesto al COVID-19, debe ponerse en cuarentena durante 14 días para reducir el riesgo de contagiar a otras personas. El 97.5% de las personas que desarrollan síntomas después de la exposición lo hacen dentro de los primeros 11 días y medio. Si usted desarrolla síntomas de COVID-19, debe aislarse de los demás, excepto para buscar atención médica.
This image shows that time frame that we were just talking about. So we have the incubation period. So from the time that you're exposed to the virus, when you become infected, it takes time to become symptomatic. What we know of COVID is not only are we infectious during this symptomatic period when signs and symptoms first develop, but we are also infectious prior to developing those signs and symptoms. And that's why the quarantine for 14 days is so important. It ensures that before signs and symptoms develop, when we are potentially infectious during that pre-symptomatic phase, we're staying away from others to reduce the risk of spreading the virus.
La propagación del virus. En esta foto vemos cómo un virus se propaga. Comienza con un periodo de incubación. Muchas personas son asintomáticas o presintomáticas, lo que significa que tienen la infección, pero no presentan síntomas. Es por eso que recomendamos el aislamiento y la cuarentena. Es posible que alguien no tenga síntomas y pueda transmitirlo a otras personas. Luego llega el periodo sintomático, donde el individuo tiene síntomas de una infección.
And what is also so important about this image, this graphic, is we may not know when our time of exposure was. We may not know when we were exposed to the virus or when we may have been in contact and become infected. So that's the importance of contact tracing. We're trying to find out when individuals were exposed to other individuals and where that transmission may have occurred. The sooner we can identify that, the better control we can have over the spread of the virus.
Por eso es importante acerca de esta imagen. Es posible que no sepamos cuándo fue el momento de exposición y estemos infectados. Por eso el seguimiento de contacto es importante para controlar el virus.
This image shows the importance of that quarantine and that isolation. As you can see, if we can prevent even one person from becoming infected or exposed to the virus, we can greatly reduce the number of individuals who may further become sick and then go on to infect others. And you see that this chain of events is linked all the way back to that one person. So that's why stopping the spread of transmission early is so vitally important.
En esta imagen podemos ver la propagación del virus. Cada persona infectada contagia el coronavirus a otras 2 personas y la cadena de infecciones crecería exponencialmente. Al evitar incluso una transmisión social, al principio de la cadena podríamos reducir significativamente el número de infecciones.
So when we talk about personal protection, and this is a phrase that I'm sure a lot of individuals have heard, the best offense is a good defense. We want to make sure that we are defending ourselves from the virus at all times. The most important things that we can do would be to wash our hands with soap and water frequently, or using an alcohol-based hand sanitizer. And the reason why we do that is to prevent our hands, which may be exposed or may have come into contact with the virus, from spreading it to other surfaces. For that same reason, we want to avoid touching our face. If we do have to touch our face for any reason, let's say you have you need to sneeze and you have a tissue, or you have to blow your nose, if you have to cough, or even if you just have a small itch or a scratch, you want to make sure that you first wash your hands before touching your face. Another recommendation is to check your temperature daily, even if you're feeling well. Sometimes an early increase in temperature or even an early fever may be the only symptom that somebody experiences. So if we check our temperature daily, even though we may feel fine, we may catch the virus or we may catch the infection earlier in its process. And we also want to make sure that we stay up to date with other vaccines. The reason why we want to stay up to date with these other vaccines is COVID is not the only thing that's going around right now. This is also the flu season. There are other infections that are present in the community that we want to make sure we prevent, because COVID can occur at the same time as these other infections. And you don't want to have COVID and the flu at the same time, because that would be a very poor outcome. That would be very bad, right? Both would affect your lungs. So we want to protect ourselves from everything that we possibly can in the hopes that we can also mitigate the severity of COVID.
En términos de protección personal, el mejor ataque es una buena defensa. Acordarse de lavarse las manos con agua y jabón, o si no pueden, usen un desinfectante de manos a base de alcohol. Asegúrense de evitar tocarse la cara, y si necesitan tocarse la cara porque estornudaron o tosieron, lávense la mano antes de tocarse la cara con agua y jabón. Verifique su temperatura diariamente, incluso si se siente bien. Y una cosa importante también es mantenerse al día con otras vacunas, como la vacuna contra la gripe. El COVID-19 puede ocurrir al mismo tiempo que una infección contra la gripe.
Now, I'm sure that I'm not the only person who has been washing their hands so much that they become dry and cracked. And it's okay to use moisturizing lotions after you wash your hands, provided that you haven't cross-contaminated or touched the bottle while your hands were unwashed. You also want to make sure that when you're washing your hands, you use a lot of friction, because that's what helps to rub everything off as you're washing your hands. And you also want to make sure that you use warm water. You don't want it to be so hot that it's almost intolerable, because that will further dry out your hands. So use warm water, constant rubbing motion for the friction, and you want to wash for at least 20 seconds or sing happy birthday twice.
Está bien usar loción después de lavarse las manos. Use mucha fricción y agua tibia, pero no caliente, ya que el agua caliente secará sus manos. Traten de hacer el movimiento de frotamiento constante durante 20 segundos, como mínimo.
We also want to make sure that we avoid large gatherings, and we would call that a gathering outside of our pod. So our pods are those who we live with, who we are in daily contact with. As we start introducing other individuals from outside of our pod or our little circle, we increase our risk for bringing COVID-19 into our setting. Gatherings between family or close friends can be especially risky, because there's a lower sense of awareness, right? We let our guard down because we're around people that we trust. And in letting our guard down, that can expose us to danger. One of the recommendations is that if anybody is visiting, that they wear a mask and you wear a mask as well, and try to do it outdoors or remain socially distant. Try using alternate strategies to engage with your family and friends. I'm sure we've all used some sort of video conferencing like today, using email, which is the modern age pen pals, or even phone calls to our families and friends.
¿Qué más en términos de protección personal? Las reuniones entre familiares o amigos cercanos pueden aumentar el riesgo de propagar el COVID-19. ¿Por qué? Porque bajamos la guardia, porque estamos rodeados de personas en las que confiamos, lo que nos expone al peligro, ¿no? Ah, recomendamos utilizar estrategias alternativas para interactuar con familiares y amigos, como la videoconferencia, Zoom, email o hasta y llamadas telefónicas.
The reason why it's so important to remain vigilant, even when we are gathering with family and friends, it was made very apparent with the past holiday season. So what we can see in this graph is in here, towards the end of November, we had the Thanksgiving holiday, and shortly after, we saw a rise in cases because families and friends were gathering for the holiday. And a similar event occurred here in December. So we have here the end of December. You could see the cases from November were starting to drop down. And then the end of December, we had the holidays again. And we then saw our highest case count ever in the pandemic. So that's why it's so important that we still remain vigilant, that we still socially distance ourselves from one another, and we keep that awareness in our minds. And by comparison, we always talk about the peak of the pandemic, right? When we had that initial March, April, that was all the way down here, the case count. Up here, 300,000 new cases in a day. So it's so incredibly important that we still remain vigilant.
¿Y por qué es importante no bajar nuestra guardia? En esta imagen podemos ver el impacto de las fiestas de fin de año. Podemos ver que en noviembre y en diciembre hay un incremento. 2 semanas después de las vacaciones de diciembre, se registró el mayor aumento de casos desde el comienzo de la pandemia. En comparación, el verano pasado hablábamos sobre el pico o el punto más alto de la pandemia, y el número de casos en noviembre o diciembre fue extremadamente mayor.
And I'm going to go back a few slides just to show that is why it is so important for us to break that chain of infection early on, because all of those cases, all of those individuals can go on to infect more individuals. So we want to be very vigilant and break that chain early on.
Y vamos a ver la imagen que presentamos anteriormente. Por eso es importante tratar de reducir o evitar una transmisión social al principio de la cadena, porque podemos reducir significativamente el número de infecciones.
So when we are in public, there are additional measures that we want to take. So aside from our personal protection, where we'd be washing our hands and trying to remain isolated or socially distant when possible, we want to make sure that we're doing the same in public. We want to make sure that we're wearing a mask. So the reason why masks work is not because they offer you protection, but because they offer your family and friends protection. In the event that you have the virus and you're in that asymptomatic or pre-symptomatic stage, you may unknowingly transmit the virus. But by wearing something over your mouth, you can actually catch those droplets. And there's been a lot of discussion about the virus being smaller than the holes in the mask. But what we have to remember is that when we are coughing or sneezing, those droplets are larger and they're also wet. So the mask can catch that and hold on to it. Wearing the mask protects others around you, and you want to make sure that you're not removing that mask at any time unless you've washed your hands and you're in a place where you can remain socially distant. The recommendation would also be to use a disposable mask so that you can discard them when they become soiled or contaminated. Surgical masks are the most preferred, but really anything that can cover your face, a bandana, a homemade mask. I know a lot of people have taken out their sewing machines and dusted them off to start making homemade masks. Anything that can cover your mouth and nose and fit appropriately would be appropriate to wear in public, because even if it offers some reduction in the spread, that little bit is incredibly important. We want to make sure that we cover our coughs and sneezes to prevent the spread of those droplets and remaining socially distanced by staying 6 feet apart. And the reason why we stay 6 feet apart is, again, because that's how far from us the droplets may stay suspended in the air. So we want to stay at least 6 feet apart. And we want to make sure that we give others enough space. So if you're getting onto the subway or onto a bus and there isn't enough room in between seats, try to move down or try to move over. And it's not always feasible. It's not always the most ideal situation, but we encourage you to really just try your best. The other recommendation is to stay home if you're sick. Now, what's been interesting with the COVID pandemic is that we haven't seen as many cases of upper respiratory infections, and that's because we've been wearing our masks. So if you're not feeling well, it's more likely that you are actually infected with COVID. And even if you aren't, we still have to make that assumption because we don't want the virus to spread. So we recommend that anyone who feels ill stay home whenever possible.
En términos de protección pública, use una máscara en público asegurándose que cubra su nariz y su boca. El uso de una máscara protege a los que nos rodean. Usando una máscara para atrapar las gotitas, utilice una máscara desechable para poder desecharlos, si se puede, ¿no? O cualquier cosa para cubrirse la cara, para evitar la propagación de gotitas. Quítese la máscara solo después de lavarse la mano. Cubrirse al toser y estornudar evita la propagación de gotitas. Y permanecer socialmente distanciado, al menos a 6 pies de distancia, es importante también. Es interesante que no hemos visto muchos casos de otras infecciones en las vías respiratorias, porque recientemente, o en este año, el que ha pasado, hemos incrementado el uso de máscara y asegurarse de quedarse en la casa si uno está enfermo.
And I'm not sure if you're able to see me or if you're just seeing the presentation screen.
I think that they should be able to see both the presentation screen. I can spotlight you, so I'm just going to give me a second. Let me
Sure.
see. There you go. I think that's
So when you're wearing a mask, you want to make sure that you select a mask that will appropriately fit from your nose all the way down to your chin. Once it's on, don't take it off. Don't even touch it unless you've washed your hands. And when you're wearing the mask, it has to stay above your nose so you can pinch it. If your mask is like this, then you can still breathe out through your nose and you can still spread those droplets. And let's say you're outside and you're walking and you go like this. Well, now whatever's on the mask is on your fingers and whatever's on your face, right? Because when you're wearing the mask, your chin is slightly exposed. Whatever might have been on your chin is now brought up to your mouth. And you can then inhale. And if there's any virus, if there were any of those droplets, you can then inhale that. So you want to make sure that once your mask is on, you leave your mask on. After you've washed your hands, when you take the mask off at home, grab from the ear loops and remove forward. The reason for that is the front here is more likely to be contaminated than the back here. So we want to come from the back loops. We're also avoiding our nose and mouth. So if these ear loops are contaminated, we're pulling them away from our face and disposing of the mask.
Asegurarse que el uso de la mascarilla cubra su nariz y la boca, y el agarre de los ganchos para las orejas, al quitarse la mascarilla, al agarre de los ganchos de aquí y lo mueva hacia adelante. Y asegurarse de quitarse la mascarilla solo después de lavarse la mano con agua y jabón por 20 segundos.
Right. And do we need to switch back from the spotlight video? Or?
I think you should be okay.
Okay. So now I'm going to speak a little bit about some of the current and emerging therapies, but before I do, does anybody have any questions?
Ahora vamos a hablar sobre las terapias actuales y emergentes. Si tienen preguntas, escríbanlas en la parte de abajo. There is one question. It says, can the variants be treated the same way as COVID-19?
That is a great question. The variants can be treated the same way because ultimately, COVID-19 is still the same virus. The variant, or the virus rather, does not want to create new variants that make it less effective or that make it non-viable. Because of that, there are still pieces or parts of the virus, like the spike protein, that remain, that stay the way that they are, or maintain very similar components. So the current and emerging therapies and treatments are still showing efficacy against the virus.
La pregunta fue, ¿se pueden tratar las variantes de COVID-19 de la misma forma? Y las variantes de COVID-19 se pueden tratar de la misma manera con el tratamiento emergente actual. And I think that's it for questions for now. Yep.
Okay, so current and emerging therapies.
Terapias actuales y emergentes.
So when we're discussing the current treatment options, we look at how sick someone is. And that would be the severity of their infection or their illness. For individuals who have mild to moderate illness, we would expect that they would not be admitted to the hospital if they have mild to moderate illness. So they would be seen in the outpatient setting. We currently have 2 treatment options that are available through emergency use authorization. The first is bamlanivimab, which is manufactured by Eli Lilly. And the second is a combination, casirivimab and imdevimab. And those are monoclonal antibodies that are manufactured by Regeneron. Because these are being administered under emergency use authorization, that means the FDA has not given full clearance because they're still being investigated. There are also additional criteria that an individual would have to meet in order to be eligible to receive these infusions.
Ahora vamos a hablar sobre la severidad y tratamiento. Las opciones de tratamiento actuales para COVID-19 son limitadas y depende de qué tan enfermo esté alguien. En una enfermedad leve o moderada, esto es lo que esperamos a ver en el entorno ambulatorio, lo que significa que el paciente no está suficientemente enfermo para ser admitido al hospital. Hay 2 opciones de tratamiento disponibles a través de la autorización de uso de emergencia.
Bamlanivimab.
Fabricado por Eli Lilly y
Casirivimab and imdevimab. Imdevimab. Yeah, they're a mouthful for anybody. Don't worry, Kenny.
fabricado por Regeneron.
For individuals who are experiencing moderate to severe illness, this is what we'd expect to see when the symptoms are severe or bad enough to warrant admission to the hospital, either for observation or because they require more intense therapies. If someone is hospitalized and requiring oxygen, they will be treated with medications that are now considered to be part of the standard of care. The first is an antiviral medication called remdesivir. And the second is a steroid medication called dexamethasone. That may be administered as an IV infusion or as a pill. In addition, oxygen therapy, some lung therapies, and other nursing and respiratory therapy interventions may be warranted while somebody is recovering from the virus.
Aparte de eso, severidad de tratamiento en una enfermedad moderada a grave. Esto es cuando los síntomas son lo suficientemente graves como para justificar la admisión al hospital. Si alguien está hospitalizado y requiere oxígeno, también será tratado con 2 medicamentos considerados estándar de atención. Remdesivir es un medicamento antiviral que se administra como infusión intravenosa y la dexametasona es un medicamento esteroide y se puede administrar por vía intravenosa o en forma de pastilla. Además, también hay terapia de oxigenación y terapias pulmonares.
So we have so limited treatments for the virus. That's where it's important that we have the vaccines. So the vaccines are what we're using to prevent individuals from becoming ill. There are currently 2 vaccines that have received emergency use authorization from the FDA, and additional vaccines are being evaluated in clinical trials. So those 2 vaccines are, one is from Pfizer and BioNTech, and the other is from Moderna. There's also this coronavirus tracker that I placed on the screen, and that shows that there are multiple different vaccines in different phases of investigation. However, not every vaccine turns into a viable candidate. So that's why it's so important that we have all of these clinical trials that are ongoing to evaluate the efficacy and the safety of these various interventions.
Por el momento, el tratamiento de COVID-19 es limitado para el virus. Por eso hay 2 vacunas que han recibido autorización de uso de emergencia de la FDA y se están evaluando vacunas adicionales en ensayos clínicos. Las 2 vacunas son la Pfizer BioNTech y la vacuna de Moderna. En la imagen podemos ver que tenemos todas estas opciones para hacer investigaciones, pero solo algunas llegan al producto final. Que como dijimos antes, nada más hay 2 vacunas aprobadas para el uso completo.
So when we discuss vaccines, we want to know, how does the vaccine work? Well, the vaccine works by teaching our body how to recognize and to fight off an invader. So as you can see with these images, we would have the initial infection. So that's where the body would recognize SARS-CoV-2. When the body recognizes this foreign invader, it sounds the alarm, which causes our fighter cells and proteins to go into action to combat the virus and block or prevent infection. So with the vaccine is training our body how to sound this alarm and how to make these fighter cells and fighter proteins. The vaccines cannot cause SARS-CoV-2 or COVID-19 illness. The way that the current vaccines work, they are synthetic vaccines, and they use pieces copied from SARS-CoV-2, not the whole virus. So we're not introducing the virus into your system. We're introducing either parts or instructions on how to make those parts, but we are not introducing the virus itself.
¿Y cómo funciona la vacuna de COVID-19? Funciona enseñando al cuerpo a reconocer y luchar contra los invasores. En la foto, el cuerpo reconoce SARS-CoV-2, COVID-2. El cuerpo suena la alarma, las células de combate y proteínas para entrar en acción. ¿Y cuál es el objetivo? Entonces, esto está bloqueado o controlado. Y la pregunta es, ¿pueden las vacunas causar la infección o causar la enfermedad de COVID-19? No, las vacunas no se están probando, que se están probando, están hechas de piezas sintéticas o fabricadas en el laboratorio, copiadas de SARS-CoV-2, no de virus completos. Por lo tanto, las vacunas no pueden causar infección ni causar enfermedades de COVID-19.
So a little bit of discussion about the mRNA vaccines. Those are the 2 vaccines that are currently available, and they use what we call mRNA nanotechnology. mRNA is an abbreviation for messenger RNA, and that's where we get the M from. This is how our cells send messages to make proteins. After a protein is made, the mRNA just dissolves, it disappears, and it's actually recycled by the cell. so that more instructions can be generated and more proteins can be made. And they are oftentimes very different proteins. The mRNA in these vaccines cannot change your DNA. They don't alter your genetic information. They don't alter your instructions, right? Your user manual, if you will. All they do is they provide the instructions for the cell to make proteins. We say nano, or from the nanotechnology, because of the incredibly small size of the mRNA and the delivery capsule. So nano represents 1/1 billionth of one. So it's very, very, very small. We use the word technology, not in the sense where we would think of a machine, right? Technology, we think of a microwave, or we think of a car, or we think of our phones. Well, technology in this sense is the more broad application, meaning applied scientific knowledge. So we have very small applied scientific knowledge, and that's what the vaccine represents.
Las vacunas de ARN mensajero o ARNM, las dos vacunas actualmente disponibles utilizan nanotecnología de ARNM. ARNM es una abreviatura de ARN mensajero, que es una forma en que nuestras células envían mensajes para producir proteínas. Una vez que se produce una proteína, el ARNM se disuelve. El ARNM de estas vacunas no pueden cambiar su ADN. En términos de la palabra nanotecnología, nano se refiere al tamaño increíblemente pequeño de ARNM y la cápsula de administración. Nano es un prefijo que representa una 1.000 millonésima parte de uno, muy pequeño. Y en la parte de lo que es la tecnología, es un término que significa el conocimiento científico aplicado.
Since the mRNA is the instructions for how to build a protein, what we can do is read that protein and figure out the mRNA sequence that made it. And that's how we've developed these vaccines. We've looked at the spike protein, which is the red projections from the virus. We've looked at the protein and we've deciphered the sequence that went into building that. And then we were able to reverse that. We made the mRNA, we introduced that mRNA. Kind of like a fax machine or a printer and scanner. We have an original, right, which is the spike protein. And when we place it through our machine, we're able to get the digital information that was sent from one machine to another, and the other machine is able to reproduce that document. And that's how these vaccines work.
Dado que el ARNM son las instrucciones sobre cómo construir una proteína, podemos leer la proteína y averiguar la secuencia de ARNM que la hizo. En el caso de COVID-19, queremos proporcionar a nuestras células información sobre cómo producir la proteína de pico para que nuestro sistema inmunológico pueda aprender a reconocerla y combatirla. Las vacunas de ARNM funcionan como una máquina de fax o una impresora o un escáner.
The ultimate goal of herd immunity is what we're seeking with these vaccinations. So herd immunity is where enough individuals have been vaccinated that they can no longer become ill, they can no longer contract the virus. If we can reach a certain level where individuals can't contract the virus, then we can reduce and even stop the spread of the virus. And we can also prevent the most vulnerable in our communities from becoming ill or come in contact with the virus. The fewer people that get sick, the harder it becomes to spread, and that's what's represented here in this image. So you see here, these two individuals can infect an entire population. However, as we slowly start to immunize and we get up to this large scale vaccination, we can prevent the spread of the infection of the virus. When we talk about masks and the vaccines, we are still encouraging and recommending that masks be worn even if you've received a vaccine, because we don't know if the vaccines can prevent you from spreading the virus. We're looking at that, and some preliminary information would suggest that it can, but these vaccines are still so new that we haven't had a chance to fully investigate that. So until we have a more clear answer, we would still recommend and encourage the use of masks, even if you've received the vaccine.
Ahora vamos a hablar sobre la inmunidad de grupo. El objetivo de la vacuna es generar una inmunidad colectiva. Si menos personas pueden enfermarse, el virus se vuelve más difícil de propagar. En la imagen, en la parte de la derecha, la primera imagen, nadie está inmunizado y la enfermedad contagiosa se propaga por la población. En la segunda imagen, parte de la población se vacuna y la enfermedad contagiosa se propaga a parte de la población. En la tercera imagen, la mayor parte de la población se vacuna y la propagación de la enfermedad contagiosa está contenida. Una cosa importante es que en este momento todavía no necesitamos mascarilla porque no sabemos si las vacunas pueden prevenir la propagación del COVID-19.
There are many clinical trials that are currently underway, and they're researching different aspects of COVID-19. Through those clinical trials, we've already received some of our therapeutics. So the 2 vaccines have come from clinical trials, and those are the preventative trials. There are also treatment trials, and it's through those that we've received those emergency use authorizations for bamlanivimab and the Regeneron compound, because the casirivimab and Mab. I know that I've said that one wrong, but they're a mouthful, like I said earlier. So those are treatment. We're also looking at some prophylaxis. So trying to treat somebody who's been exposed, but who haven't become ill or contagious yet. So those are the clinical trials overall.
Los ensayos clínicos. Hay muchos ensayos clínicos que investigan diferentes aspectos de COVID-19. En términos de prevención, antes hablamos sobre la vacuna. La vacuna es administrada antes de una posible exposición. Profilaxis, tratar a alguien después de la exposición, pero antes de que se enferme. Y tratamiento, medicamentos y terapias para quienes están activamente enfermos.
When it comes to clinical trials in the community, participants really are representatives of their community. Through someone's voluntary contribution to science, and I cannot stress that enough, participating in any type of clinical trial is voluntary. We can seek to understand similarities and differences among different groups of individuals. So we can stratify some of our results based on medical history, demographic information, to see if there are different impacts based on different backgrounds. There is, and I do place this note in here, there is an undeniable history of unethical actions in clinical trials, both in and out of clinical trials. Because of that, there are many protections in place for clinical trial volunteers. So a lot of protections were developed after 2 fairly large and well-known events. The Tuskegee syphilis experiments, where individuals were intentionally infected, individuals from the Black community were intentionally infected with syphilis and were not given the proper treatment. We also have the Nazi doctors from the Holocaust who conducted human experiments without permission, without consent. And it's for those reasons that we've developed regulations and codes and rules that protect clinical trial participants. So we have the oversight and regulatory agencies to ensure the safety and protection of every participant. And we even have special regulations for children and vulnerable populations. So for anybody who may be handicapped or disabled, there are additional protections. For anybody who's a minor, additional protections. For anybody who may be in jail or in prison, there are additional protections because you would be considered to be at risk or vulnerable of being coerced into participating. And that's not what we want in science. We want individuals to volunteer, but through that volunteerism, we're able to understand the impact on a community. And clinicians who do conduct clinical trials have to go through specialized training before they're allowed to participate. And that training is to reinforce these ideals and notions.
Ensayos clínicos de la comunidad. Los participantes en los ensayos clínicos son representantes de su comunidad. Mediante la contribución voluntaria de un individuo a la ciencia, podemos tratar de comprender las similitudes y diferencias entre los grupos. Es importante recalcar que existe un historial innegable de acciones poco éticas en los ensayos clínicos, como por ejemplo en los experimentos de sífilis y de Tuskegee, en los que en las personas afroamericanas no se le dio tratamiento incluso cuando había un tratamiento de sífilis disponible. Aparte de eso, pero debido a esto, existen muchas protecciones para los voluntarios en el día de hoy en los ensayos clínicos. Como por ejemplo las agencias reguladoras y de supervisión garantizan la seguridad y protección de los participantes del ensayo, regulaciones especiales para niños y poblaciones vulnerables, y los médicos reciben capacitación especial para realizar ensayos clínicos.
So in closing, and I know I'm just a couple minutes over, the only way that we can overcome this pandemic is together. Remember that the virus cannot survive without a host. So following the guidelines that we discussed today and the recommendations from the CDC will help to keep you and your loved ones safe. The current vaccines that we have are safe and effective in preventing or lessening the severity of COVID-19. And there are some treatments available right now with more on the horizon waiting to be discovered.
Como resumen, la única forma en que podemos superar esta pandemia es juntos. Recuerde que el virus no puede sobrevivir sin un anfitrión. Si sigue las pautas, usted y sus seres queridos estarán seguros. Las vacunas actuales son seguras y efectivas para prevenir o disminuir la gravedad de COVID-19. Hay algunos tratamientos disponibles en este momento, con más en el horizonte y esperando ser descubiertos.
So I want to say thank you to Dr. Tripp Gulick, Dr. Marshall Glesby, and Dr. Kristen Marks for sharing their slides, as well as the staff of the Weill Cornell HIV Clinical Trials Unit. And I also want to thank all of the clinical trial participants that we've encountered to date and across the country and across the world. Their individual participation is saving countless lives. So very appreciative of that. And I want to thank each and every one of you for doing your part in keeping yourself and your community safe.
En agradecimientos al Dr. Roy Tripp Gillick y Dr. Marshall Gillespie y la doctora Kristen Marks por compartir sus diapositivas o las presentaciones a la unidad de ensayos clínicos del VIH de Weill Cornell. Gracias a todos los participantes de los ensayos clínicos que han contribuido a la comprensión científica de la pandemia. Su participación individual está salvando innumerables vidas en todo el mundo. Y gracias a todos ustedes por hacer su parte para mantener la seguridad de usted y su comunidad. The next presentation in the series, which will be on February 23rd, same time, 10:30, 11:30, should be 2 weeks from today. La próxima presentación en esta serie va a ser el martes 23 de febrero, de 10:30 a 11:30. Será 2 semanas después del día de hoy. Questions, preguntas. Also, I will start the poll. Voy a comenzar lo que es la encuesta.
I have a question.
Yes, go ahead.
Is there a rash that is associated with this virus that is in the environment? I notice a lot of people are scratching around their neck or on their arms. And I do it also.
So there is a rash that's associated with the virus, and thank you for that question. But the rash is more to do with the clotting factors that we see in the blood. So it's more of a discoloration. The itchiness and the scratching sensation, to my knowledge, is not associated with COVID.
Thank you.
La pregunta fue, hay una erupción en la piel asociada con este virus. Y la respuesta, hay una erupción asociada con el virus. La erupción tiene más que ver con el factor de coagulación de la sangre. Es más como una decolorización en la piel, y la picazón no ha sido asociada con el virus. Let me see. There is another question, and this one says, Yeah, so a family member of mine found out that a colleague at work tested positive. What should be the immediate action at home if the space is limited?
So if the space is limited, the immediate action should be to isolate or to quarantine as best as possible. So if you have multiple rooms in your residence, designate one room as the quarantine room and try to restrict movement in and out of that room whenever possible. Make sure that all surfaces are clean and decontaminated, and make sure that you are tested. You want to wait at least 3 to 5 days after the possible exposure for the test to be accurate.
Ajá, la pregunta fue, ¿qué tengo que hacer si alguien ha tenido contacto con alguien que tiene COVID-19? Acción inmediata en la casa es aislarse o hasta una cuarentena es lo mejor posible. Debe designar una habitación en la casa como la sala o como una sala de cuarentena y asegurarse de que todas las superficies estén limpias y decontaminadas. Parte de eso, esperar de 3 a 5 días para ser chequeado por COVID-19.
Another thing is make sure, and I know that it's winter time, so this is probably not occurring commonly, but try to keep the windows closed. When you open your windows, that can generate positive pressure in the room or that wind gust, and may actually blow the air from in the room out into the shared or common areas, which may increase risk for exposure. So try to keep the windows and doors closed.
Aparte de eso, trate de mantener las ventanas cerradas. Las ventanas abiertas generan una presión positiva, la que puede soplar en las áreas compartidas donde se comparten, ¿no? con otros familiares. Let me see. I think that should be it in terms of questions. If anyone has any questions, please feel free to share your questions.
I have a question.
Go ahead.
A woman told me that her son had the COVID, and then she got the COVID from him. But she said when he went to the hospital, they didn't do anything for him except send him back home. But I saw in your presentation that there is an IV that can be given or a pill. So is it possible that what she said is not correct? Or does it depend upon the severity of the COVID?
That's exactly it. It depends on the severity of the COVID. The treatments, the remdesivir and dexamethasone, are indicated for that moderate to severe COVID. So if he was clinically presenting, and I'm not familiar with the case or what may have been the presenting symptoms, but if he was well enough that he didn't warrant admission to the hospital, then he wouldn't be a candidate for those treatments.
Oh, those treatments are only given in the hospital?
Yes, for patients who are admitted with COVID-19 because of the severity.
Okay.
La pregunta fue que tiene una amiga que su hijo tenía COVID y cuando llegó al hospital no recibió nada. Depende en términos de tratamiento, si el tratamiento depende de la gravedad del COVID y la respuesta fue sí, el tratamiento sí depende de la gravedad del COVID. Por ejemplo, si una persona está grave y está internada en el hospital, se le va a dar tratamiento por remdesivir. And then let's see if we have any.
May I have a question?
Sure, yes, go ahead.
Yes. My question is, in this time, it is very hard to get a vaccine shot, right? The vaccination.
Mhm.
And you talk about if we keep the social distancing, wash hand more frequently, and cover your mouth and everything. That means if I stay home not going out, it's not necessary to get the vaccination, the vaccine shot, right? Or
Receiving the vaccine is an individual choice, and it's based on the number of risk factors that you would have. So as you're saying, if you were to stay home and remain socially distant and isolated from other individuals, then it wouldn't be as urgent for you to receive the vaccine because you wouldn't be at a higher risk of contracting COVID. Now, let's say that you change your daily routine or your daily habits and you start going out into the community more often, then it would be, I would recommend stronger consideration for receiving the vaccine.
okay. Another question is because I called to CVS, she said maybe you can get the vaccine shot on April. I think it's too long to wait. And also they recommend me to do the flu shot. So I just wonder if these two things is interaction or no, and which one should do first, flu shot first or vaccine first?
That's a great question. And what we actually are recommending is that you wait 2 weeks in between receiving another vaccine and a COVID vaccine. So if you wouldn't be able to receive the COVID vaccine until April, then I would recommend getting the flu shot now, because then you'll have enough time in between the two vaccines and you'll be able to receive that COVID vaccine in April.
Yes, because I just think about it, if I got the vaccine first and the first dose and waiting maybe 28 days for second dose, and how about they told me you can have the flu shot. So I don't know which one. We have a separate in 3 days, or which one put first and which one later waiting put them back.
Yeah, so if the flu shot's available now, then I would recommend receiving that now while you're waiting for the COVID vaccine to become available.
So before I get the vaccine, I cannot have a flu shot, right?
For 2 weeks prior.
Because I don't know, can I accept the flu shot now or no?
Yes, you'd be able to receive the flu shot now if you received the COVID vaccine in April. So if you got the flu shot now, then looks like, so by the end of February, first week of March, you'd be eligible to receive the COVID vaccine. So that
Yes,
would give you plenty of time in between.
Yes, that is my question. I think if I got the flu shot now, and maybe after 1 week or 3 days, they say, oh, you can come for vaccine, for COVID-19 vaccine. So I don't know which one. Should I keep the day separate? How long? How many days separate? 1 week or 10 days?
2 weeks or 14 days in between the flu shot and the COVID vaccine. If the flu shot is available now, then I would encourage taking that, only because we know that the supply of COVID vaccine is more limited than the supply of flu shots at this time.
Yes, I know COVID-19 vaccine is more important. It's important than the flu shot, but the flu shot is in hand now. But
yeah, and they're both important because they'll both protect you. So while we're still in flu season, it would be important to protect yourself from the flu, and you can receive that vaccine while you're waiting for the COVID-19 vaccine.
And these two were interaction or no?
There are no interactions reported, but we do want individuals to wait 2 weeks in between receiving the doses of the flu shot and the first COVID vaccine.
La pregunta fue si es difícil conseguir, porque es difícil conseguir una vacuna. Si mantenemos el distanciamiento social, es necesario vacunarse. La respuesta fue, al recibir la vacuna es una elección individual, pero claro, eso depende de los factores de riesgo que uno tenga. Si usted está en contacto con mucha gente, piense si tiene que recibir la vacuna o si quiere ponerse la vacuna, tenga eso en consideración. Aparte de eso, ¿puede la vacuna de COVID-19 interactuar con la vacuna de la gripe? contra la gripe, si van a tomarse la vacuna, las dos al mismo tiempo, espera 2 semanas entre recibir una vacuna de COVID-19 y una vacuna contra la gripe. And I think that should be it in terms of questions. Thank you very much, Jonathan, for today's presentation. Thank you, everyone, for joining us today. Like I said before, the next presentation will be in 2 weeks.